Hello everyone, welcome back to YUNO Learning. In our series on how to build upon your lexical resource in a much more effective and productive manner, we bring to you yet another video on the theme coronavirus. Now, during the course of pandemic, we've heard a couple of terms multiple times, but do we actually recognize or know their exact meanings? So here's a list of words that you've used frequently during pandemic and a list of possible meanings in column B. You have to pause the video for 5 seconds and try match the words with their appropriate meanings given in the other column. The answers are number 1, quarantine, that stands for C, separating and restricting the movements of infected people. Number 2, social distancing, that stands for A, putting physical distance between yourself and others. Number 3, self isolation, that stands for F, voluntarily agreeing to limit one's movement and interaction. Number 4, E, vaccine, that stands for substance injected to stimulate antibodies that provide immunity. Number 5, lockdown, that stands for option B, emergency situation in which people are not allowed to enter, leave, or roam in an area. Number 6, unprecedented times, that stands for D, something that has never been experienced before. Now let's go ahead and deconstruct the term epidemic. The part of speech it hails from is noun, meaning sudden increase or prevalence in number of cases of a disease throughout a community. Etymology, from Latin epidemia, that means prevalence of disease, wherein epi stands for upon plus demo stands for the people. Sentence, COVID 19 reached epidemic proportion in China during the month of January. Some key terms derived from epidemic are number 1, epidemiology. Noun, study covering causation and description of epidemic. Epidemy, noun, an epidemic disease. Epidemicity, noun, state of being epidemic. Epidemically, adjective, spreading rapidly and extensively by infection. Some other terms are number 1, asymptomatic, adjective, showing no symptoms of a certain disease or disorder. He did not receive the ideal patient care after he had been infected with the virus because he was asymptomatic. Endemic, adjective, always existing level of disease in a community, for example, common cold or flu. Sentence, scientists claim the traces of COVID 19 will always exist in endemic levels in a community from here on. Pandemic, noun, an epidemic spread of over various countries or continents. The pandemic had a significant toll on not only physical but rather mental health of people. Contagious, adjective, a disease that can be spread from one person to other. Sentence, isolation was highly necessary for COVID infected patients as well as those not infected because of its highly contagious nature. Diagnosis, noun, identification of an illness by examination of symptoms. Diagnosis for COVID 19 was very ambiguous due to the significant lack of knowledge regarding the disease. Incubation period, noun, time period between exposure and development of symptoms. Sentence, incubation period for the virus determined the duration of quarantine. Some technical terms regarding coronavirus are PCR test, full form, polymerase chain reaction, which is a test to detect viral particles in blood or other bodily fluids. The PCR test is a swab test done to detect any genes specific for the SARS CoV 2 virus. PPE, personal protective equipment, Special clothing, including headgear, goggles, etc., to shield one from infection or infectious materials. Healthcare workers had to use new PPE for each patient interaction. Then we have ventilator, a machine to help patients with damaged lungs in breathing. A ventilator takes over the breathing process of a person so as to provide time for the lungs to heal. COVID 19, which is coronavirus disease 2019, a disease that can be spread from one person to other. Isolation was highly necessary for COVID 19 infected patients, and hence people with suspected exposure were kept in quarantine. N95 respirator, non oil based mask with 94% efficiency. Now, N95 respirator is a mask for protection against viral disease. Sentence: the CDC does not recommend N95 respirators for public use as it requires a 20-minute fit test to ensure proper fitting. SARS, severe acute respiratory syndrome, a coronavirus which infected humans. Sentence: SARS reached epidemic proportions in 2003, however, there has been no outbreaks since then. Some questions asked in IELTS exam regarding coronavirus are: what useful technology helped us combat the coronavirus? What do you think could have been done better in terms of dealing with the coronavirus outbreak? Q card: describe a situation where someone you know was afflicted with some contagious disease. You should say who was the person, what were they infected with, how did their family control the spread, how did the doctors help them. And we've tried answering one of the questions with the vocabulary we just learned. What useful technology helped us combat the coronavirus? The most important medical technology that helped in the unprecedented times of coronavirus epidemic were ventilators. Due to the inability to breathe incurred from lung damage from the virus, ventilators played a crucial role in buying patients time to heal. The technology behind contact tracing and testing, such as PCR testing, were quite effective in identifying and controlling the contagious nature of disease and thus flattening the curve. Also, apps for delivering daily updates and guidelines for social distancing, sanitization, etc., have fairly contributed to awareing people and henceforth in the recession of cases. Now, here's a writing question asked in the IELTS exam, which is: some people think that the pandemic has impacted our lives, especially the education sector. To what extent do you agree or disagree? Now, try answering this question with the vocabulary we just learned. That's all for today. For more personalized live IELTS and spoken English classes at affordable prices, enroll today. And don't forget to subscribe for more such content.